trying to get ahead of violence in the community. That's the goal for the city of Knoxville. Tuesday evening, City Council approved 3 new contracts for violence prevention, all funded by the Office of Safety Violence Interruption Funds.
We always have said that in our neighborhoods that are experiencing violence, higher levels than most, we want to have carrots and sticks, and the sticks are, our law enforcement and, that sort of prevention and enforcement actions, but we also want to invest in other ways.
$35,000 will go toward a contract with VisionLet. The company will host social emotional workshops in the Project TLC areas to caregivers and their families to strengthen emotional bonds. Project TLC is a safety initiative led by KPD, the city, and community partners in specific neighborhoods aimed to reduce violent crime. $60,000 will be for Covenant counseling services for victims of gun violence and their families, as well as the community. Resident Denise Jackson says one service from Covenant Counseling that's important is narrative-focused trauma care.
And that is a program that encourages people who a lot of times don't know how to explain their trauma or to even tell their stories to be able to do so.
Then there's $31,050 for Health Alliance for Violence Intervention, or HAVI, to train the University of Tennessee Medical Center and the city's Community Safety Department. It's their program called Hospital-Based Violence Interruption Program, or HVIPS. HAVI will train hospital and city employees to be violence prevention professionals, treating and supporting people injured from community violence.
Really can be that bridge between social work at the hospital, between getting appointments scheduled, but also they understand what it means to be that person healing from that type of violence. So they literally walk with them every step, help them find resources, whether it's employment, housing, getting back into the education system.
Dr. Kendra Simmons is the Senior Director of Communities of Practice for HAVI. She says the program doesn't just focus on treating people who are injured, but also addresses concerns for retaliatory violence.
Can work with the individual and look at what are those next steps? What are those safety concerns that they have, and really work with that individual and talk about what are those next steps and how do we prevent that retaliatory violence.